Dr. Soto, what makes you different from the other specialists who claim to treat head and neck pain?
I think the big difference is, first off, I try to find the source of the pain. Because once you can find or diagnose that patient as to really where that trigger point, that impulse, that negative impulse that's feeding the brain center, and I feel real strongly about this, that I can identify it now. Of course, it takes a lot of testing. We need to do a lot of testing. That's really important. And scanning, that sort of thing, so we can find it out. I also think it's really quite important that the patient see the medical specialist, like a neurologist, ENT, because many of these are related to that. And they need to be cleared of that. I want to be sure before I see that patient that I'm treating a patient, for example, and I take away their pain, but I lose the patient 6 months later. You know, we don't want to have any pathology. So I'd like to get that green light. I'd like them to see a neurologist and get an MRI or MRI scans and have their exams done. I'd like to make sure they've seen an ENT if there's any question there. So that clears that area out too. Because again, if there's any pathology, some of this is beyond my scope. Obviously, you know, I need to get them to someone, and I don't want to find out in the course of treatment that patient then has to be referred out.
Right.
I'd like them, when they finally get to me, that, hey, I've got the green light, I can go about doing what I do best.
Right.
You know.